Hi, a question we often get asked is what's the best pillow positioning or sleeping position for low back and neck pain? So I wanted to touch on that a little bit. Today we have our model who's just lying here flat on the bed. And what I wanted to point out for the lower back is usually, and you can try this at home, if you lie with your legs straight, you might feel a little bit more arch in your lower back as you're lying here. If you bend your knees way up to what we call a hook lying position, you'll feel your low back drop a little bit more towards the table or towards the bed. For most of us, somewhere in between these two, or maybe closer to this position, might put your back in what feels most comfortable, more of a neutral spine position. Now, again, people are like, I can't sleep with my legs that high, and I totally get that. But this is where the foundation of putting a pillow under your knees kind of comes from. It helps bring that lower back into a more neutral position. So, for example, I'm going to take this pillow and have Bianca come a little bit straighter with some pillow positioning under there. Now, again, the amount of low back arch that you're starting with, the amount of low back pain you have, might dictate how high or low this pillow should be. I would say for most people, starting about this height, so 9 inches or so, 9 to 12 inches, is usually going to put the back in the best position. Some people feel better on things much higher, so you might need more pillows or even purchasing some of those wedge cushions that they sell to put your back in a more neutral position. People slide these right in under the covers. And you do hear the, oh, my spouse says I'm taking up too much room, things like that. But you have to do what's right for you to have the least pain and get the best night's sleep that you can so that you can heal. During sleep, if you kick these out, not a big deal. If you wake up due to pain, put them back under, but you don't have to worry about keeping them there all night, tucking them in, strapping them to yourselves, nothing crazy. We want you to get the best night's sleep with less pain. As for the neck, I want to come up to the head and neck position here. You'll notice right now, this pillow kind of tucks under her shoulders a little bit. So in my opinion, that's not the best, most ideal position. So we're going to slide this out a little bit, and then we're going to bunch it kind of down right into the top of her shoulders. What we're trying to do there is actually have the pillow come and fill that gap in her neck. She wants to be supported. I shouldn't be able to see any gaps or feel any gaps. My hand shouldn't slide in underneath. We want the spine to be supported in its most neutral position. Also, if you look at her lying here, if I drew a line through her spine, through her neck, down into her trunk and her spine, it's all horizontal. The pillow is not too propped up. Her head is not tipped backwards. Both of those positions would add strain to different structures in the neck and possibly cause pain. This pillow height can vary based on people's posture, the posture of their upper back. If you have a very rounded upper back, when you lie flat on a table without a pillow, for example, your head's going to tip way back. So you really want to make sure that the amount of pillow height would match the fact that if you drew that straight line from the neck into the upper back, that it was one straight line for wherever that angle would be for you. Usually, it ends up being about 10 to 15 degrees up from completely flat on the bed. If you're not sure, have a spouse, family member, friend take a picture of you while you're sleeping and get down to kind of even level. Take that picture and see where you are during the night, what position you tend to be in. From there, you can bring that to a physical therapist, to another family member if need be, and say, okay, let's try to get some pillow heights that can get me to a more neutral position. As for the low back and neck, one position I'm less of a fan of is sleeping on your stomach. Again, some people love it, and if you can do it without pain, I'm not going to mess with you. I will say, though, it is the hardest on the lower back to sleep on your stomach, but also your neck has to be turned way, way, way to one side. So I'm going to have Bianca demonstrate rolling onto her stomach with no pillows for 1 minute. So roll all the way over for me. Okay, so here in this position, Bianca was good. Most people don't sleep with their arms way down here when they're on their stomach. They're usually going to be like that. But you can notice her head has to be turned way to one side, which again gives asymmetrical pressures and stretch through different structures in her neck. And now here, the lower back kind of sags down a little bit. Again, naturally, we have a curve there. However, the softer your bed is, the more it's going to sag down, which can put you in too much extension or too much arch, causing pain. So some of the corrections for the lower back. Again, I can't change much where your head is because otherwise you're going to suffocate with your face down in your pillow. And for the shoulders, as long as you're keeping them in a neutral position, you might be okay. I do have people who complain of shoulder pain on their stomach because they sleep with their arm up overhead. But if you can sleep kind of like this position, your shoulders would probably be okay here. The first correction I want to make, or adjustment with pillows that could help, is to put a pillow under the lower abdomen. So come on up for 1 second, Bianca. Tuck that there. Good, come on down. So I want it kind of in that lower area, so belly button to upper pelvis. And now I don't know if you can see, I'm sure she feels a little bit more supported. She's not sagging all the way down there. Again, you don't want anything too high that you're going to be sleeping, super rounded, but you are looking to prevent the back from being at its end range extension. Also, for more comfort in this position, sometimes we put a pillow under the shins. Feet can hang down over, and that puts everything in a much more neutral position. How does that feel?
Better.
Good. And again, this is if you have to sleep on your stomach, but if you are okay trying another position, I would say most of the population tends to sleep on their sides. So we'll have Bianca roll onto her side facing the camera. Roll these out. Give her a pillow back under her head. Good. So in this position, and she did it a little bit already with her hands, you can see she did prop her neck up a little bit. So again, looking at that neutral alignment, if I want to know what size pillow she should have for her head and neck, I want the neck to be in a straight line with the spine coming all the way down and parallel to the floor. This pillow height's pretty good. What I will say is a lot of people who tend to tuck their hands under, sometimes it's because they don't like that feeling of their head tipping down a little bit. Do you feel like you're tipping down if you take your hands away?
I do.
Yeah. So that would be either we bunch the pillow or get a second pillow a slightly higher. Does that feel better?
Yes, it does.
Yeah. So bringing her a little bit more to a neutral position. Just a little cheat that I've learned as a PT, the hand tuck. If that's what people do, they're really propping up their head sometimes. So again, the pillow pushes down onto the top of the shoulder, meeting that curve in the neck. I shouldn't be able to slide my hand through, but I also don't want this pillow too far under her shoulders because then it's not going to be giving adequate support. So that's the good neck alignment there. For those of you who have seen my other video for the shoulder, you might see this pillow kind of here. If you're having any shoulder pain, to keep that elbow and shoulder in a nice parallel horizontal alignment. And now when we're coming down to the legs for the lower back, I'm going to remove this pillow just for a second so you can clearly see her pelvis. Often what happens is we might have some people having hip pain here because as you can see, the knee drops down, which puts tension and pull through all of this and adds some compression sometimes through the hip area. That can cause pain. The other thing that people do sometimes with this leg on top is it does cause a little bit of a rotation through the pelvis and the lower back, or they tend to bring this leg forward and they might sleep more than like that. So what we're looking for with pillow position in this area is to make that pelvis neutral and to not let that hip drop down. So we'll see, we might even need a little bit more. So she's still dropping down slightly. Grab a second pillow and lift up. Let's see how we do if she puts that down. Good, that looks more horizontal. Is that feeling okay?
Mm-hmm.
Good. So again, we're getting more horizontal alignment from knee to hip. It also can help prevent, sometimes when people have pillows in here, if she needed this much height, I would actually recommend finding one pillow that's thicker rather than the two, because the two sometimes do slide. She still could kind of do that in her sleep and end up out of position. But we can often get one thick pillow and maybe even have it stick a little bit farther out past your knees so that leg isn't tempted to kind of drop down and fall forward. But again, what we're looking for is neutral spine alignment all the way throughout, neck to spine and legs. Everything stays nice and supported. To minimize pain while you're sleeping and get the best night's sleep so that you can heal. If you have any other questions, please let us know.